Okay. Um, Welcome everyone. It looks like the clock has struck 6:30 here, Eastern time zone, so we are ready to begin. I believe that, some families might continue to join us, and that's fine. But I want to officially get started and welcome you all to today's virtual session for parents and families of our incoming students. The room is definitely filling up, as I said, and if you have any questions about the functionality of your microphone or audio, or any questions about the presentation, please use the Q&A feature and the chat feature. My name is Sarah Maslin-Fothery. I'm the Director of Parent Relations at Dickinson, and I'll be moderating today's session. And I'm so happy that you could join us for today's presentation about helping your student thrive as a Dickinsonian. Now, normally we would be presenting this on campus in person during orientation, and there would be quite a bit of discussion. So again, I just want to reiterate how we are here to engage with your questions, whether we do so throughout the presentation or at the conclusion of it. We will do our best to get through everything. But also please know that this presentation is being recorded, and it will be followed up it will be sent to you through a follow-up email, and will also be available on our website. So you'll be able to access it at a later date if you continue to have questions afterwards. You can also submit your questions after this presentation to parents@dickinson.edu, which is an email address that I will be monitoring, and I will make sure that we get back to you on your questions. Now, without further ado, it's my pleasure today to introduce our two panelists, our two presenters, Angie Harris, who is the Associate Vice President of Student Life, and Don Dominici, who is the Executive Director of our Wellness Center. They will introduce themselves and share a little bit more about the work that they do at Dickinson with our students, and then we will begin the presentation.
Hi, I'm Don Dominici. I'm the Executive Director of the Wellness Center here at Dickinson. I'm a psychologist by training, but in my role here at Dickinson, I'm overseeing an integrated center of staff members, all types of healthcare providers. So we have counselors and psychologists on staff, social workers, psychiatrists, and on the other side, we have health services, which consists of nurse practitioners and a medical assistant who work in conjunction with a collaborating physician. And we have a registered dietitian on staff as well. So our office is broken into 3 different clinics: health services, counseling and psychiatric services, and nutrition services. We all work together. We provide integrated care. We share confidentiality. We can collaborate and make referrals throughout our office, and make referrals off campus when we need to as well.
I'm Angie Harris, and I'm the Associate Vice President for Student Life. That means I have responsibility for basically everything that kind of falls in the residential experience, from residence life and housing, and student conduct, to student activities and clubs and organizations, Greek life, and those kind of things. So, and one of the pieces of my role is also to chair our care team that responds to student concerns and issues on campus, as well as I'm responsible for the kind of 24-hour response that student life has for student issues. So I get to do all of those things, which is exciting, and I'm sure that we all wish we were in the room together giving this presentation. I can tell you that I much prefer to be talking with you live and seeing your faces rather than staring at my screen. So I hope you bear with us as we try to make this presentation work and answer the questions you have for this unique semester and unique start to the academic year. We'll get started.
Okay.
So we will make this PowerPoint available also to you. There's a lot of information that you might want to refer back to, and so we will make it available to you. The purpose of this presentation is really to give you an overview of academic and social transition issues We'll specifically go into some transition issues that may be unique to this specific year. We will share some of the most common challenges that students face in their first year, and then we'll also talk about the roles that families, parents, students, and staff can play and to help students if issues arise. Hopefully you know this already through the search process, but our mission at Dickinson is to provide useful and innovative and interdisciplinary education in the liberal arts and sciences to prepare students to lead rich and fulfilling lives of engaged global leadership, working for the common good. I think that's our challenge, especially this semester being remote, to live up to that mission. And I think we've done a lot of planning and preparation to provide an experience. I believe that we'll live up to that mission. That's what keeps us driving forward. I'll talk a little bit about our parent philosophy. Working with parents, we really believe that you are the expert in your child, right? And so we really want to work with you so that we can together build your students' confidence and help them be successful here at Dickinson in their college experience to whatever challenges they may encounter. We welcome you to share concerns with us, but we will, when a student comes to us, we will encourage them to take appropriate actions. And we really hope that you will also nurture their problem solving and encourage the same. We encourage you to let us know if you are starting to see issues or concerns or even just have questions about your student's experience. Often when parents call us, we will first say that we'd like to talk to the student first if it does indeed involve the student, but we're happy to consult with you and talk with you before that happens. But we will want to involve the student as we want to encourage their own kind of decision-making and problem-solving skills. And just, we don't routinely report out any academic, social, medical, or personal problems to parents. And so that really, it may feel a little bit one-sided, that communication may have to start with you or we'll be working with your student directly. But because of FERPA, we're not allowed to report that out specifically. You can go to the next slide, sorry.
Oops, sorry.
Yep, yeah, there we go. One more back, sorry. It's just the last part of that parent philosophy is that we really, if you do have a serious or immediate concern about your student, we do want you to call and let us know. And the Department of Public Safety is available 24 hours a day, so 365 days a year. My office is in the Vice President and Dean of Student Life's office. We're available during business hours, typically Monday through Friday, 8:30 to 4:30, but DPS is available all the time. So if there is a serious or immediate concern that especially about your student's physical well-being, or we want you to make the college aware, and those are the numbers that you can call for help. Now I'll come back to FERPA that I mentioned. FERPA is the Family Educational Rights and Privacy Act. It is a federal law that we must abide by as an institution that gets federal financial aid for our students. And so it means that basically we have to treat your student as an adult. And they are the owner of their educational record. And so we really are limited into what we can share with you about really anything specific to them and their experience. This could even be like as simple as you haven't heard from them in a while and you just want to know that they're okay. What we will do in a situation like that is contact your student and ask them to give you a call back versus us calling you directly and saying, oh, we made contact with Joe and he's doing great, he's doing fine. We'll actually have to have the student call you back. Now there are, the student can sign a waiver, a consent form that would give permission for us to talk with you. And so if you have more questions about that, if you want to talk, I encourage you to talk to your student about this. I know one question that often comes up when we start talking with about FERPA in this session is, I pay the bill and I should know what my students' grades are and what's going on with them. Unfortunately, that's just, it's not the way that we can share information. But if you are able to talk to your student and they are willing to sign the consent form, we can talk with you about concerns that you may have or issues or related to their academic record. I think that's it's a good conversation to have with your student before they get started, if that's necessary. It also can just happen as needed. So if something comes up and there is a need for a discussion, your student could sign the release at that time. But you can find more information about FERPA on our Dickinson website by just searching FERPA. It will also take you to the consent form and where your student will have to sign the form. They'll have to log in and sign it, but it is possible to find it on our website.
One thing I'll just add about that is FERPA does not extend to a student's medical records here on campus. So although our wellness center is on campus and we do see students, we have our own consent process. We are bound by HIPAA and other state laws and ethical codes. We cannot disclose information, even if the student has signed a FERPA release, and that includes to the college. It's one of the things that that help students feel comfortable coming in for treatment is knowing that their information is not going to get shared all over college, all of the college with staff or other students or anything like that. But if they want information shared back home with a doctor at home, with their somebody in student life, the dean of students office who's helping them navigate a leave of absence or disability services, access and disability services, something like that, they can sign a release on our end. So two separate levels of confidentiality. All right, so one of the main things we'll be talking about today are key transition points during the first year of college and beyond too, not just the first year. And again, as Angie mentioned, this is a particularly unique year. So we're hoping that this year will still feature high points and things that your student will be proud of and enjoy about their first semester here at Dickinson. But there are also significant personal and academic challenges that can come up over the course of a student's time in college, and particularly the adjustment of that first year. One of the things we'll highlight is that, as the academic year progresses, there are different difficulties and growth opportunities that come up depending on the time of the year. So different events happening at various points during the semester. The changing of seasons can bring on different challenges and also some positive aspects as well. So a big part of this presentation is looking ahead and getting a little bit of the roadmap of what types of things sometimes come up during the first year that you might anticipate. And again, we're gonna do our best to look at this year in all of its uniqueness and talk about some of the things we would anticipate being different this year as well. So we'll talk about the following typical concerns. You'll notice the first one on that list wasn't on that list when we did this presentation a year ago. So we're going to start with that and kind of look at what the college's response to COVID-19, which you are already most likely aware of. But then we'll talk about some of the more typical concerns that come up, the things that all college students are navigating in one way or another. What is the adjustment process like? How do I get involved and stay involved? What is it like living with a roommate? And this year it'd be a virtual roommate, but how do I navigate, decisions about alcohol and drugs, deal with common health concerns and safety issues and so on. So we'll start with COVID. You're already pretty well aware of how Dickinson is responding. I mean, we're looking at it. We are interacting virtually. So class is being held remotely. That is changing the nature of this semester. We are, President Ensign has said it many times that the safety and health of our students is the #1 priority. So we are wanting to still give students the Dickinson experience while also prioritizing safety and health. And when we can safely bring students back, we will bring students back and have that experience right here on campus too. There are a number of things we're implementing on campus in terms of keeping students safe, but I will highlight a couple of things that apply to all students, whether you're on or off campus. And a big one is health monitoring. We're encouraging all students and staff and faculty, all members of our community. You should really be monitoring your health. And one of the ways we're going to help students do that is by implementing a symptom tracker website that is actually run through our wellness center's record system, but has their own separate COVID system that's not tied to any medical records. It's treated separately. So students will be encouraged, anyone who's on campus, students or staff or faculty who are working on campus, is going to be encouraged and required to self-monitor, to enter, answer a couple of basic questions into that daily symptom tracker. Log into the website, answer a couple questions, and if they've indicated any health risks, we're going to have somebody follow up with them, make sure they're getting the care that they need. So only students who are on campus and staff and faculty will be required to use this, but everyone's encouraged to use it and everyone will have access to it. So it's a good way to keep track of how you're doing and a good reminder to us all to be paying attention to potential symptoms, potential exposures, things like that. As I mentioned, there are a number of things on campus we'll be putting into place. For example, everyone will be required to wear a face covering when they're within 6 feet of somebody else on campus or in a shared space on campus. Everyone will be asked to practice physical distancing and maintain that distance whenever possible. We're limiting the size of gatherings. Of course, we're adhering to the regulations of the state of Pennsylvania in some of these things, but also putting our own community standards in place to protect our community. I'll have Angie talk about the visitor and guest policy on campus, which is another new thing.
Sure. So there actually it's a pretty small number of students who will be on campus for this fall, and even a smaller number of new students who will be on campus. But we know some of you may be a parent. You may be a parent of a new student. So we're not going into significant detail here about what's happening on campus. And so I would say if you're a parent and have additional questions, we're happy to go into further detail with you. We just wanted to try to give an overview for everyone to understand what's happening. For the visitor and guest policy, I guess that actually could impact all students. Anyone who's not approved to be on campus is actually considered a visitor this semester. And visitors will have to register, and they'll have to be, have a purpose for coming to campus, and we'll have to fill out a form so that we know that the visitor came to campus, and so that we can track that for contact tracing if necessary. We consider guests, and this is consistent always, but a guest is any student who is not a resident of that residential facility. So it can be just another student visiting a student across campus and in their residence hall, that kind of thing. So we also have limits for the students on campus for the guests that they can have to protect our community.
All right, so move into a little bit about adjustment to college, which is, again, a normal part of the transition that students experience in their first semester, first year of college. However, this is a unique year where the adjustment will look a little bit different. We are all dealing with transition right now, and transition that sometimes changes, day to day, week to week. So starting college is I'm guessing for many of you and your students, just one other transition this year that has happened this year. But when we look at the normal adjustment process that happens at college. It can sometimes be prolonged. It can sometimes take a year or longer. A lot of people focus and ask about that, that initial starting college, getting used to the academic changes and getting used to the experience. But it doesn't all happen right away. There are things that happen across the year that can make that adjustment process, be more or less relevant for different students. Sometimes that second semester back can be more difficult, or the second year of college. And what I would emphasize here is really to expect that this year will continue to consist of multiple transitions. So, starting college, and then at some point there'll be that transition of, starting college on campus, starting at Dickinson on campus. So this is something that we would expect might prolong the adjustment process, and it may morph as we go semester by semester as situations change. One thing that doesn't change is that we always encourage students to have that balance of connection with home and on campus. Typically, students are immersed in campus and have that connection with home. This year, it may be the opposite. So it might be more challenging to maintain that connection on campus. Of course, students are going to be connected with their professors and taking classes, and professors are more than willing to reach out and have conversations with students. But also thinking about staying connected to their virtual RA, staying connected to other staff members here at Dickinson, and really getting more of that full college experience by taking advantage of everything that Dickinson has to offer in that department. Another thing that I often recommend to students is remembering, and I would encourage you all to remind your student of what has worked in the past, when they've dealt with transitions in the past, even though they were different and the newer transitions might seem harder. There's certain things that maybe have worked well for them, and maybe certain things that you've done that have helped them with that transition. So really remember what those are, and try to to go back to those if they've worked well. We all have to be to come up with novel solutions as well. So there may be new things they need to try, but it's always good to start by not reinventing the wheel.
So student involvement is still possible, and we're going to really work hard to get your students involved this semester in the Dickinson experience. In particular, they'll learn more about this in orientation next week, but there will be a virtual activities fair coming up on Sunday, the 23rd. And this is going to give them an introduction to clubs and organizations and ways that they can engage with other students and meet other students. Even though it will be virtual. And we really do, and we always encourage students to try to find one or two activities that they're passionate about or they're interested in. It might be things that they didn't do in high school, or continuing a passion that they had and were really involved with in their high school years. We know that involvement is crucial to students' success. When students can engage and are involved with one or two organizations, when they make one or two close bonds with someone on the campus, and they find one faculty member that they really connect with, those are the those really do contribute to their overall satisfaction, their overall positive feelings about Dickinson. And so we, as a college, will try to help them make those connections. And we also hope you as parents will help them and encourage them to make those connections with activities and organizations, with their peers and with faculty and staff on the campus. Often in the first year, students will just try to get involved with a lot of different things. Everything, when they go to the virtual activities fair, everything's going to look exciting, and they're going to hear about things and see students doing some really cool things that haven't thought about perhaps. And so we do encourage them to try to whittle that down to one or two things, to have a deeper level of involvement in those two things. But the first year really is about figuring that out and trying to, you know, dabble in a few things to see what really sticks and where they might find their group of people. And so I encourage them to do that. And we'll talk a little bit more about their roommate as a connection, but they will have a virtual RA, and they do have their orientation assistant already that they're connected to. And so we're going to continue to find ways to connect them to upper class students, so that when they get on campus, they will already have so many friends and connections, even in other class years. I'll lastly talk about, we have an online platform to kind of facilitate this, and it's called Engaged. The students have access to it through the Dickinson Gateway, and they actually will, they'll actually participate in their virtual orientation through Engaged. So they'll become very familiar with it, but that's actually where they will find out what's happening. There's a calendar of events there, and they'll be able to log on and search for things that are happening and learn what's going on. It's kind of like the virtual bulletin board of flyers that will be would be hanging on campus. But we use Engaged all the time, but it's going to become even more important as we are online. I said we would talk about getting to know your roommate. We were very intentional to continue to give the roommate assignment this year. We talked about that as another opportunity for connection. And we've gotten some positive feedback that has been good for your students to get to know another new student. Now, some of your students have no problem getting to know new people, but for others, it is more challenging. And so we will the virtual RA will be working with them, providing prompts, helping them kind of continue to get to know that person throughout the fall semester. We really believe that living with another person practices some really valuable skills, and our Residence Life program really seeks to kind of help students acknowledge that they're practicing these skills. I'm sure you all can see that, you know from living with even people you love, that it's not always easy. And so it's even harder sometimes when it's not someone you like, or it's just someone you might not have picked. Now, our algorithm is fairly successful, but we do have times where the students just weren't a good match. And so we want you to let us know, especially this semester as they're getting to know each other, we have this unique opportunity to possibly make a change. Now, we aren't going to immediately go there. We're going to try to encourage students to take some time to get to know each other, but we do have these few months to practice and for them to get to know each other and to see how it goes. But let Residence Life and Housing know if things aren't going so well. We really do want to make sure it's the best match possible.
All right. So one question we sometimes get is about how alcohol is treated on campus, and give you a little bit of sense of how we see it. And again, it's going to be a little bit different this year, but I think some of these questions, some of the decisions that students have to make, that people have to make in this phase of life, are similar regardless of where you are. So periodically we survey our students about their alcohol use to try to get a sense of prevalence on campus and what the needs are there for our students. So you can see some of the descriptive statistics from our most recent survey in February. You can see that, a large majority of students indicated using alcohol at least once in the last year. About half, a little more than half, reported at least once in the past week. One thing I will point out is that what I hear from students a lot is, it seems like everybody drinks and I will not find friends if I don't drink. Now this is more of an on-campus issue, but I think this exists, anywhere where alcohol is a part of the culture. And you can see from our survey that over 90% of students said that they think the average Dickinson student uses alcohol at least once per week. But it's only a little bit above half. And about a fifth of students, when surveyed, reported not drinking at all in the previous month. So I think it's important to, for students to try to find different ways of connecting and not falling into that trap of thinking that, alcohol is the only way. Now, some of this may be, some of the pressure may have been there in high school and maybe there in other social settings as well. But I think the issues, while they maybe look a little bit different on campus, are pretty common for students this age. Next slide. When surveyed about other substances, by far the second most widely used substance reported by students was marijuana, with about half reporting using at least once in the past year, and a little less than a fifth reporting using at least once in the past week. So that is second to alcohol. And again, we see a little bit of a difference between, while it is something that exists on campus and in other areas as well, a little bit of a difference in what students' perceptions are versus what's going on. 2/3 of students said they think the average Dickinson student uses at least once per week, whereas again, it was about a fifth. And over 70% of students reported not using all in the past month. So, another in a series of choices that students and people in life will have. One thing to note is that get a lot of questions, not a lot, but more in recent years about medical marijuana. It's important to note that that's something that's prohibited on campus per federal law, even if it's prescribed. We're subject to federal laws, and that includes any product containing THC. So our approach to discussing substance use is harm reduction. So all students will get multi-step alcohol education virtually. They'll have a chance to survey themselves and get a sense of what their own relationship with alcohol is and, impact on their lives. And that's a survey that will be up. We'll do it as part of extended orientation, but it'll be up and anybody can complete it. It'll be up it's already up on the Wellness Center's website. So that's something that students, we encourage, sort of monitoring, looking at your use. Anytime a student goes to the hospital or goes through the conduct process, we will have a mandatory meeting with them to talk about, decisions they made, how they got to that point. And again, looking at harm reduction, not at, judgment or blame or saying, well, you shouldn't use it all, but really looking at if you choose to use, what's the impact if you make that decision? How, what was the result in this case? How can you be safer next time? That kind of thing. We do offer alcohol and drug counseling and can provide referrals if students need these services at home in their areas. What can you all do to help? Talking to your students about keeping safe and how they're gonna, what's their plan for navigating that decision about alcohol and or other substances. If you think there's a problem, emphasizing the importance of seeking help. It's really important to keep those lines of communication open. And again, kind of talking through their decision making in a way that if there is a problem, there'll be a little bit more openness, even around this particularly difficult topic. If there is a problem, that they can come to you about it, and we are always here to help. Shifting gears to general health. Angie, did you want to add anything else about the?
No, I think.
I don't know if you had anything.
No.
To cover. Okay. Shifting to general health. Like I said, at the Wellness Center, we're an integrated center. So we will often see a lot of the common physical illnesses that you see up there. For students on campus, we're primary care. We're the same as going to your primary care practitioner anywhere. So it runs the gamut. Most of our visits are acute illness, upper respiratory infection. We've had the challenge over this past year of looking at upper respiratory infections a little bit differently and making decisions about when we do test for COVID. And that's something we can do as well in conjunction with our local laboratories here. We do a lot of sexual health education and appointments at the Wellness Center. We do STI testing. We do sexual health visits, general physical exams. As I mentioned, and I'll go into in a little bit, for students who are off campus and not coming in to see us on campus, we can consult and help with referrals if you need to find services in your area, for students who aren't already connected with a doctor at home. Mental illness is something we deal with a lot as well. In many cases, adolescence is the first time that mental illness will present or it will exacerbate, become a little bit more intense than maybe it was in earlier adolescence at the college years. The most common things we will see when we do counseling here on campus are anxiety and depression. Those are number 1 and 2 by far. But really what we see runs the gamut. And I'll throw out that you probably, read a lot about how, COVID-19 is impacting people from a mental health perspective in addition to physical health and risks there. There was a national survey done about in the spring of college students that looked at a little bit of this and revealed that yes, college students were reporting increased depression and lower levels of psychological well-being on measures when surveyed in the spring. However, there was also a report of decreased substance use, probably attributed to more of the isolation and many students going home across the nation, and increased levels of resiliency, which we think is key. It's not necessarily about the negative experiences, all about the negative experiences that we are all going through, but needing to have tools and skills to deal with those. So as we think about engaging with students this semester, although we are far away from many of our students here, we still want to engage and have conversations about topics like resiliency and skills and how are we all dealing with the global pandemic and with the day-to-day stress that we all have in our lives. Here's some general information about the Wellness Center. I'm not going to go into all this. A lot of this is about our new policies for in-person appointments, not relevant to a lot of you. But I've already shared, we do integrated care. We are open weekdays, 8:30 to 4:30. Our services are confidential, which I shared already, and there are no charge for visits. We want students to have access to our services, we have some charges if we're doing medical procedures or medication or lab work or things like that. But in terms of visits, we don't want initially getting in the door to be we don't want a cost to be a barrier. Check out our website. We have some COVID-19 resources and general wellness resources, physical and mental health, both on our website. We want our website to be a touch point for students who need information, but we are also available to consult as well. And again, I won't go into all of our different procedures, but you have them there for for students who are on campus or when you are back on campus. A lot of these things will still apply. One question that I've gotten from a number of students and parents are, well, what services are available this semester? You don't have many students on campus, we're afar, what can you do remotely? And there are some things we can do remotely. It's going to be more limited. All students, we're going to offer the following services. We will, if a student needs to consult about something wherever they are, if they have a question and want to know, how do I get connected with services, or I have this issue, should I see a doctor? Should I talk to the doctor about this? What are some good reasons for getting involved in counseling? We will be available to consult. We will have during business hours, any student can call and ask to speak to one of our staff members. If somebody's not available, we'll have somebody call them back or set up an appointment. We will also have some common times that for counseling, we will always have somebody available who can take the call. And those are our open hours. I don't have them listed here, but it's 11 to 12 and 2 to 3 every weekday. So if somebody has a question, we're here. We can also offer virtual support in the form of groups and workshops and discussion groups for all students. And we're going to be rolling out some of those. We have some of our staff members here have some creative ideas for getting information out there and getting opportunities for support that a lot of students might find beneficial. So check back on our website over the next couple of weeks for those. And again, we can also assist anyone with identifying appropriate treatment referrals or online resources. So anyone can call for that. For students who are on campus, we will have, most of our appointments will be virtual, but we'll do in-person appointments with safety measures in place if we need to. Not all appointments are appropriate, or not all presenting issues are appropriate for virtual appointments. So we will have that option when needed, and in particular if somebody is in crisis for a mental health emergency on campus. Let me change the slide. For students who are off campus, we will also offer appointments when appropriate. In most cases, working with a local provider wherever the student is at home is going to be the best option. And we can assist students with finding local providers whenever needed. Some of the reasons for this are, if you're working with somebody locally, they're going to know the local resources. They're going to have connections with other services in the area. They'll know about crisis resources, and for students who are out of state, they will know the relevant state laws as well. They're also going to have the option to meet in person if that becomes necessary. Not all appointments are appropriate for virtual, and we're doing that with students here on campus. So if a student can access a provider at home, that's generally going to be the best course of action. We'll assist with that. If that's not the case, then we will always talk to a student and see what they need and make treatment decisions on a case-by-case basis. Often it will be limited what we can provide from afar, but if there's something we can do, we will. If a virtual appointment is appropriate to a student's needs, and depending on their location or what kind of support they're needing, we will do what we can to assist. In some cases, we may not be permitted to treat students out of state, but if there is something that we can offer that a student can't get locally, we'll have that conversation and offer that service. And then, as I mentioned before, for anyone who we can't offer treatment, we can always offer the consultation and virtual support groups that you talked about. What can you do to help? If your student is sick, encourage calling a healthcare provider. This is a message that I say every year, but is especially poignant at this point, especially if they're COVID-19 symptoms. Again, I talked about self-monitoring and tracking symptoms earlier. We can help if students need help finding a provider. For students on campus, we're often the primary care provider. Another thing that I say every year, but is relevant now more than ever, is getting your flu shot. If we can limit the prevalence of the seasonal flu, that's gonna be that many fewer cases that a provider is going to be thinking might be COVID. So because there's some overlap in symptoms. So getting a flu shot and trying to take care of to reduce the prevalence of seasonal flu is going to help everybody. We encourage good hygiene, hand washing, getting good sleep, basic self-care. You've probably heard this in other places as well. Again, it's at the forefront in the public mind at this point. We do have, thing I didn't mention before, we do have a first-year student health program. Typically that involves in-person appointments, well visits, where you get to meet our providers and hear a little bit about our services. So students can come in, meet with one of our nurse practitioners, meet with our dietitian, get some general good nutrition advice there, and then meet with a counselor and get some general advice about self-care. That will still be available. That is something we can offer virtually. And if students are interested, they should call and ask to sign up. So it's a good way of getting connected. And if not now, then, when students are on campus again, this is a program that can be taken advantage of at any point. So just kind of getting in the door. In case of emergency, we've got some emergency resources there. If there's an emergency, don't call us, call 911 for mental health emergencies, calling a local crisis center or National Suicide Prevention Hotline. When students are on campus, they can call our Department of Public Safety. And if the Wellness Center is open, they can call or come in to the Wellness Center. But it's important to not wait if there are potentially life-threatening concerns that are coming up. So you can see I've listed a couple at the bottom. Headache or intense stomach pain, generally good to contact a medical provider and rule out things like meningitis, appendicitis, suicidal thoughts, or psychosis, delusional thinking. Generally a good idea to get some help immediately for those types of things. We do have an after-hours phone triage service for medical advice. So if you have, stomach pain and a student is wondering, is this GI issues or do I have appendicitis, they can call and talk to, they're called Access Nurse. So they would talk to a registered nurse and get some advice about whether they need to go to the ER or whether they can wait and talk to their primary care physician, when their office reopens or go to urgent care. That is something that all students can access. So that number is good anywhere. And if they call that number, they'll be able to give some advice. They'll also notify our office at the Wellness Center. So if we need to follow up with a student, we can do that too.
So I think this slide, we went back and forth about whether we should talk about it this evening or not. I think, most of it applies to being on campus. But I think safety is always can be a concern anywhere. And so obviously good habits to develop no matter where you are. I'll just specifically talk more about online safety. In particular, I think sometimes our students, because of having the dickinson.edu email address, have phishing scams. Those kind of emails you get from seemingly overseas asking for help, but those seem obvious. I think sometimes they aren't so obvious, that they can actually look pretty real. They've gotten more and more sophisticated, and unfortunately some of our students have fallen victim to some of the scams that they've received through their address. So we've done some things to help protect that. Our Library and Information Services staff is always trying to monitor and limit the amount of junk kind of emails that are coming through and dangerous emails that are coming through. One thing that your students can know is that anything that they're getting in their email account that's from outside of Dickinson is going to have a banner at the top, making it clear that it's coming from someone outside of Dickinson. And so if they get a message that looks to be coming from the president but has that banner across the top, then it's likely not coming from President Ensign. And so there's things like that have happened. So we just, you can help your students just be careful about their email and their just online safety in general. With social media and being careful what you share. We have to kind of build some trust slowly, so they'll get to know their students that are in their classes and that kind of thing. It's just I know they're already so engaged, especially in on Instagram and Snapchat and all of those great social media tools. But sometimes people get through in those and could seemingly be Dickinson students, and we just want to make sure if they ever have questions about something they receive, they can definitely reach out to our office or even to the Department of Public Safety for assistance. When they're on campus, we do have resources like a campus shuttle that goes around, including our campus, including some off-campus locations like Walmart and the Carlisle Diner, which is a popular spot for students later in the evening and at night, really. DPS is also willing to walk with students if they're leaving the library late at night. So we anticipate that we may end up giving a different version of this presentation once your students actually come on campus. So we'll definitely give reminders about this. I'll end with the red alert system. The red alert system is how we communicate during emergencies on campus. And so we do want, your students should sign up for the red alert. I don't know that they will get anything this semester being off campus, or unless there's something that's happening on campus, they may get it. But, and so, I'll leave it to them if they want to sign up now or not. But it could be anything from a severe weather, a warning. It wouldn't be like a watch, but like if something's imminent, a warning, we may send a red alert about that. This is where we would communicate if there was an active shooter on campus. And so there's, they'll get information about a red alert. Often I get a question about, can parents sign up for the red alert? And unfortunately, the system is not designed to allow for parents to join. So you will have to encourage your student to communicate with you if you're curious about that. What we will do during emergencies is post information to our website. And so right now you can see kind of running across the top of our homepage is an announcement about COVID-19. And if there was ever an emergency on campus, that's one of the ways we would put information out to parents so that you know what's happening. And that's our protocol. It helps cut down on the phone calls that come in during those emergencies, but also allows us to communicate with you what's happening. Also, your students are going through some sexual violence prevention right now as part of orientation. We have lots of resources on campus. I'm just going to kind of go through, I'll just kind of put these out there that there are resources out there. Your student is learning about our resources on campus now, but I'm hopeful that this isn't going to become this won't be an issue for your student this semester at least. But we do a lot of programming on campus related to sexual violence and sexual harassment and misconduct. And that all comes out of our Title IX office, but we also do additional programming around healthy masculinities, healthy relationships, and bystander intervention. I'm trying to speed through here so we can get to some of your questions. You'll see academic support. I'll probably just point you to a webinar that's happening next Tuesday at 5 p.m. Is the Office of SOAR, which is the Strategies, Organization, and Achievement Resources. That office is going to be giving a webinar next week for students, but parents also can participate in that webinar. And I think you'll learn a lot more about academic support in that session. But your student does, and hopefully has already maybe had some communication with their academic advisor, or at very minimum, the Center for Advising Internships and Lifelong Career Development through their summer advising session. If your student has had an IEP or or maybe has some other health-related issues that could impact their academic work, I do encourage you to be in touch with Access and Disability Services. They're the office that help kind of coordinate any kind of accommodations that are necessary for students. And then lastly, we have an award-winning writing center and qualitative reasoning center that hopefully you've already learned about through the admissions process. Other resources in student life, I list all these offices here. We're going to make this PowerPoint available so we can come back to it, but I think I'll just skip through so that we can get to some questions. Sarah, how are we doing with questions?
We have quite a few. I don't know if we're finished, I can stop sharing my screen and we can run through.
Sure, I think that would be fine.
Okay.
It's probably the more important part.
Yeah, no problem. There is a question about regarding medical information. It says, what if we have a medical proxy for their child?
Sometimes we'll get parents submitting medical proxies to our office, and we will honor those. What we'll do is we'll put them on file, and then if there is a concern where it needs to come into play, some of the medical proxies will come into play in certain situations. So if it is relevant, then we will have it in the file and be able to act on it. In most cases, even when there's a release or a medical proxy on file, if there's a situation where a parent or anybody's calling for information and we can speak to the student about it first, we typically will. Obviously, there are some situations where that's not possible or not advisable, but that's usually my first go-to is to let the student know directly, and then either have that conversation together or individually with the parent.
Sure, thank you. There's a question addressing transitions and adjustment periods, and acknowledging the fact that while students are still at home, they're in that high school routine, and it may be harder for them to transition into taking more responsibility as they would have had they physically gone off to college. So with this being a COVID remote experience, do you have any suggestions for how to help students make that transition, or suggestions on the best way for them to make this transition knowing they're still at home?
That's a really good question. Mm-hmm. In some ways, I kind of see the current situation as maybe a little bit of a training wheels type of situation, because we have students that they get here, they're on campus, and they're independent from day one, relatively, more or less, and they're handling their stuff. And then we have other students who that transition is a lot harder, and they stumble out of the gate. And that balance between staying connected with home and being on campus is a challenge, or they're just not ready for it. So in some ways, this is sort of a unique opportunity where you can encourage them to handle things directly, reach out to your professor, and you wouldn't have to do this in high school, but this is what you do when you're in college. But you're also there and you've got that regular contact with them, and don't have that situation where they're potentially not calling home for weeks, or you're not hearing anything from them. So good question. I could see it as a bit of a double-edged sword. Angie, do you anything else you want to add anything to that?
Well, I think I would have a conversation with them before even classes start, or before even maybe orientation starts next week, and let them know that you want them to take on this increased responsibility, that you're there to support them, but that you're going to leave it up to them to participate, to do the things that they need to do, which includes participating in orientation. There are mandatory events that they will have to be to attend, and then they get into their classwork. And I think it's appropriate to check in with them to see how things are going, but really resist that urge to, I think as a parent, it's going to be, the challenge also is going to be, you're going to have the challenge too of kind of backing off, right? Where you might have asked them about their homework and what's due tomorrow and that kind of thing on a maybe daily basis. Now we're gonna, you might want to back off and really encourage the student to, and they may be surprised by that. They may be surprised that they're at home living and you're just kind of backing off a little bit and letting them do, but I think they'll rise to the occasion, right? If they start to get into trouble, we do have some pieces along the way that will alert them that they are starting to get off track, including early in the semester, we have what we call early alerts, where faculty will let the academic advising office know if they have concerns about a student. We also have at roll call, which will happen at fall pause, so halfway through the semester, we have what we call roll call grades, and the student will get a U or an S. And so they'll understand an S is good, satisfactory, U would be unsatisfactory, and they'll understand their how they're doing midway through the semester. So that's also a good check-in time for you all to know that, to check in with them and how are things going, because they will have had some immediate feedback from their faculty at that point.
We have a couple of other questions. I think that we'll probably have to follow up offline with some of them. There is one maybe we could address in this last minute or so, just about the sexual assault education on campus, just wanting a little bit more information about that.
Oh, sure. Sorry, I did skip through that pretty quickly. Right now, they are getting some information virtually. So there's some modules that we have them go through, and that would have been the same if they were coming to campus. We start with some online modules. I think next week during their virtual orientation, they'll also hear from our Title IX coordinator, who will talk a little bit more about resources. And our office, the Title IX office it does a really good job of balancing kind of the support that they need to provide, but also the kind of the upholding the policy that they have to enforce with Title IX. We've had a lot of conversations about sexual misconduct, especially since the spring. You may have heard about some of those, and our students are pushing us to always continue to be better, and we appreciate that. And but at the same time, we also have the federal government who's also handed down some guidance that changes some of the things that students want to see from us. And so we will be spending some time explaining kind of the new guidance that's out and how we have to approach that new guidance and how it differs from what students were asking for in the spring. And so I think all students will see kind of some presentations that will happen throughout the semester about that. Hopefully that answered your questions. I think that if you have more detailed questions about that, then I would encourage you to go to dickinson.edu/Title IX, and there's a lot of information there.
Thank you. As I said, there are a couple of other more specific questions about certain, individual scenarios, students who have just changed their mind from deferring and will now be an active student. We'll follow up with you regarding all of your questions. And I just want to reiterate what I said at the start of this discussion this evening, that if you have additional questions, you can address them to parents@dickinson.edu, and I will make sure to filter those questions to the right individuals so that we are promptly responsive to your questions. We know that orientation does begin for your student next week, and although it is in a remote setting, there is still a lot that you need to determine and to figure out in order to feel as though you are preparing them to be successful here. So with that in mind, and with the end of our time, with our time running short, I just want to thank you all for joining us. Thank you for spending time with us here this evening or afternoon. And Angie and Don, thank you very much for your thorough explanations and for your thoughtful presentation. And to all of the family members who are on and who have participated with us this evening, we look forward to getting to know you. We look forward to getting to know your student and to supporting you every step of the way. So please do reach out, and we officially want to welcome you to our Dickinson community. And we hope you all have a great rest of your evening, and we wish you the best of luck as your student prepares for orientation next week. Thank you.